Hi, this is Yafang Cheng. I'm leading the Miniava research group at the Max Planck Institute for Chemistry in Germany. The focus of my research are aerosols in the atmosphere. Aerosols are tiny solid particles or liquid droplets suspended in air. They are key elements of the atmosphere and the Earth system, influencing air quality, climate, and human health. For example, aerosol particles can interact with solar radiation, seeding clouds and precipitation. In particular, human respiratory aerosols are involved in the transmission of SARS-CoV-2 and the spread of Covid-19. The effectiveness of face masks in preventing the transmission of SARS-CoV-2 has been debated since the beginning of Covid-19 pandemic. One important question is whether masks are effective despite the forceful expulsion of respiratory matter during coughing and sneezing. And this is the wall that I was keen to break, and to show why and how masking up is essential for us to win the war against this pandemic. Here it shows that the probability of infection changes non-linearly with the number of viruses to which a person is exposed. In a virus-rich regime, the infection risk is close to unity and not sensitive to changes of virus number. However, in a virus-limited regime, reducing virus number by wearing masks can effectively reduce the infection risk. So, whether the masks are effective in preventing the airborne transmission of SARS-CoV-2 depends on where we are on this curve. Based on measurements of samples from patients and indoor environments, as well as epidemiological data, we find that most environments and contexts are under conditions of low virus abundance in the virus-limited regime, where face masks can effectively limit the probability of SARS-CoV-2 transmission. The challenge we are facing now is not just whether we could win the war against this pandemic, but more importantly, how fast we can win in order to save more lives. Because lower the virus load, the higher the mask efficacy is. So we can expect synergetic effects of combining masks with other measures such as ventilation, distancing, as well as vaccination. This is especially important for the potential virus-rich environment, such as medical center, hospital, crowded indoor settings, especially with more contagious variants of the viruses.